Hi, welcome to another video on the Research and Health channel. This time, we will provide you with the update on the coronavirus disease or COVID-19. And all the information that we will provide to you is based on scientific evidence from research and health sources. Now, one cannot deny that we are living in the unprecedented times of this pandemic. Life has changed, and we have adopted accordingly. A few habits like covering of face with a mask has now become a norm. I guess this is human nature. We are good in adapting to the situations, but we just need to be reminded at times. Now, coming to the topic of the updates. The causal agent or the virus for the COVID-19 disease exhibits a similar structure to the SARS-CoV-1, which also originated in Wuhan in China in the year 2002 from civet cats, I believe, and the structure is somewhat different from MERS-CoV, which originated from the domestic camels in Saudi Arabia, and that was in the year 2012. However, the source of origination of the SARS-CoV-2 is still unknown. It is assumed to have been started from a seafood market in Wuhan. The transmission of SARS-CoV-1 was controlled within the 8 months of its inception. It had infected around 8,100 individuals and was limited to a particular geographic area. Whereas in the first 5 months of COVID-19, this has managed to infect more than 2.6 million people and continues to spread. According to the data from this week, there have been 30 million cases and close to 1 million people have already died. The main source of transmission of the virus is droplets, and transmission can occur while we are in contact with an infected person through their coughing, sneezing, and even through their normal breath. A study in a controlled environment indicated that the droplets coming out of a person's mouth could remain in the air, suspended for substantially long time, and depending on the external factors, they may travel up to a distance of 26 feet. However, the most visible droplets fall within the first 6 feet of their travel. Now, the reason why SARS-CoV-2 has a greater potential of transmission than the SARS-CoV-1 is because the SARS-CoV-1 virus inhabits in the lower respiratory tract where the replication takes place, while the SARS-CoV-2 has the ability to initiate most of the replication while it is residing in the upper respiratory tract. This leads to the peak of symptoms at a median value of 5 days later in SARS-CoV-2 in comparison to SARS-CoV-1, therefore resulting in greater number of asymptomatic carriers. Now, based on the available evidences of the infection being transmitted through droplets, with higher possibility of the droplets traveling to a distance of 6 feet, and also that there are greater chances of asymptomatic carriers in and around us, mask is sorted as an important tool in preventing the transmission of the coronavirus disease. The Center for Disease Control in the United States has indicated that the probability of infection transfer is considerably low upon wearing masks. There are in vitro studies which have showed decrease in the viral load of SARS-CoV-2 if the patients are asked to perform a pre-procedural mouth rinse while they are going to a dentist. However, there are no clinical studies which support the antiviral effect of any pre-procedural mouthwash or pre-dental mouthwash against SARS-CoV-2. Importantly, because the oral and nasopharyngeal regions are the initial inhabitation areas for the SARS-CoV-2, Some studies have already started to enhance possible role of dental practitioners in interrupting the transmission of the virus. According to studies published in Oral Diseases, oral health care is being treated as a Cinderella service in community and among hospital patients. They said that timely prophylactic oral hygiene regimen and awareness of deleterious outcomes of poor oral health may greatly improve the health among vulnerable patients, therefore bridging the gap between oral and general health for better patient care. When the patient is infected, he or she is asked to go for a quarantine. Now, quarantine is an essential part of recovery. A rapid review in the Cochrane database suggests that the chances of spread of infection decreases if the quarantine is enforced by about 96%, and also the proportion of deaths are decreased by about 76%. But there are some do's and don'ts. The person under quarantine should stay at home in a separate room to others. No visitors should be allowed. The patient should rest and hydrate himself or herself with fluids and eat healthy food. They should keep in touch with the family and friends through social media, calls, and text messages. Always monitor yourselves for the symptoms, such as fever, cough, and fatigue. Now, the things that you should not do while in quarantine is going to work, school, or university, or going to religious gatherings or other places of worship, or catching taxis, buses, or any other public transport. Participating in social or sports events is also not advised. You should also not share food, drinks, or utensils with others, or go to public places like cafes, restaurants, and markets. Next, we should be reminded to follow certain etiquettes of coughing, also keeping distance between us while we are communicating with each other, and wearing the mask all the time, especially when you are not alone or in a close proximity to others. A research published in New England Journal of Medicine have used the Bayesian model, and they gave us the following results. The half-lives of SARS-CoV-2 and SARS-CoV-1 were similar in aerosols, with a median estimate of approximately 1.1 to 1.2 hours. The longest viability of both viruses was on stainless steel and plastic. The estimated median half-life of SARS-CoV-2 was approximately 5.6 hours on stainless steel and 6.8 hours on plastic. The authors concluded that the virus can remain viable and infectious in aerosols for hours and on surfaces up to days. Also, the stability of SARS-CoV-2 was similar to SARS-CoV-1 under the experimental circumstances. This indicated that the differences in the epidemiologic characteristics of these viruses is probably arising from other factors, which include high viral loads in the upper respiratory tract and the potential for persons infected with SARS-CoV-2 to shed and transmit the virus while being asymptomatic. Now, on a lighter note, I think neither of these fellows would disagree about putting a mask on. However, the frequency of mask wearing may differ between them. So, to conclude this lecture, I will reiterate, follow the precautionary measures as suggested. We are living in the unprecedented times. Life has changed and we have adopted accordingly. We have to focus on our moral responsibilities. A few habits like covering our face with a mask should be a norm. Johnny Cohn, he said that we have a chance to do something extraordinary. As we head out of this pandemic, we change the world, create a world of love and care, a world where we think about each other, a world where we are kind no matter what class, race, sexual orientation, or religion or job we have. That brings us to the end of this video. If you liked the video and found it to be informative, please do care to like, subscribe, and share. If you would like to know how to search for scientific evidence, which we have shared in our previous video, please click on the link that appears on your screen. Stay safe and bye for now.